Sounds like we don't have any reporters on the phone, but if that changes, you'll let me know. Trying to facilitate this kind of work happening from remote for those who need to do it from remote. Also happy to welcome interpreters Randy Dzwenka and Carla Duprat here to help us out today. We had really good feedback on doing this yesterday, so thank you. So good afternoon. Just before this press conference, City Council and I had the opportunity to meet with City Administration to further discuss our city's response to COVID-19 and how we're working together to protect Edmontonians. I'll give you an update on that in a second, but first let me say how truly moved I am by City staff who are working around the clock to ensure that Edmontonians are safe and provided for. And I also want to thank Edmontonians themselves for everything that they're doing to help flatten the curve. We truly appreciate your efforts to protect our communities, and though this will be tough going, I'm confident that we are resilient and we will get through this together. With the province having declared a public health emergency, Council and I discussed the option today of declaring a local state of emergency. However, at this time, it's our belief that the situation does not currently warrant such action on the part of the city. City staff currently have all the authority they need to keep Edmontonians safe. And given the extraordinary powers that a local state of emergency would give to city administration, including the power to overrule your elected officials and restrict civil liberties such as the movement of citizens, we do not yet think it necessary to take those steps. We can revisit that on an hourly notice basis. With respect to what we are hearing out in the community, and we heard this from many councillors in their thoughtful questions today, we do hear the concerns of business in our community. Employers and entrepreneurs are under a tremendous amount of stress right now, and we appreciate that. And while I can't give you details or specifics at this time, I will say that the City of Edmonton is looking into deferrals of property tax collection for taxpayers and for ratepayers. Details will follow. We are, even as we speak, working through the details with the City of Calgary, the Alberta Urban Municipalities Association, and the Government of Alberta, ideally to take a consistent approach across the province. But the city takes those looming bills very seriously and understands that paying them will be a challenge. So we will come up with relief on property taxes and ideally utilities. Details to follow. Edmontonians, you can still help your local business community by supporting those local businesses. Order some takeout, buy a gift card for later use, shop online, and when you're stocking up on supplies, continue to consider your local grocers and businesses first if you can. With respect to our vulnerable citizens, our vulnerable community, particularly our homeless population and those at risk of becoming homeless or living in precarious and overcrowded conditions, that continues to be a serious concern for our city and our council and for me as your mayor. I have always seen homelessness as a public health problem. And with this new threat, however, I do worry that our homeless population could be exposed to a public health emergency if all orders of government do not act decisively. The city does continue to work with Alberta Health Services and with community partners to implement measures to support isolation and social distancing for at-risk populations, and that will continue to evolve in the hours ahead. We had very strong assurances in our conversation with the Deputy Prime Minister last night that this is a consistent concern across the big city mayors and one that the federal government heard, and we were pleased to hear the Prime Minister make specific reference to it in his announcements this morning. So at this point, I would say very good coordination with the federal government on the national response, and my initial reaction is that the sweeping measures announced by the Prime Minister and the Finance Minister should provide some relief to organizations and businesses and households who are concerned about making ends meet and putting food on the table and staying safe through this unprecedented time of disruption. That on behalf of the big city mayors, we truly appreciated the Deputy Prime Minister's willingness to make time for us with everything she's dealing with, and her active and continuing willingness to partner with the Federation of Canadian Municipalities and the big city mayors to get feedback on the effectiveness of the federal measures and further action that may be required to support better results and good results, not just on the public health side, but economically and socially in our communities. And I appreciate the regular contact with the Government of Alberta on these pressing questions of supporting municipalities to deliver financial relief to ratepayers and taxpayers, as well as support for the vulnerable population. Those two pieces are moving very quickly today, and some of the things that are coming are for the province to announce, because it's for them to backstop. But I'm encouraged by the conversations that we're having today about our vulnerable population and support for taxpayers and ratepayers. I wish I had more specifics for you now, but those will emerge. We're working on it. So happy to take your questions.
So Mayor, can you just expand upon, I know you mentioned which is the mentioned deferrals, so are we talking both residential and commercial? And what can you tell us at this point?
So we know that the pressures for business are probably the most acute, and so that's where the conversation has started. At this point, how broad the deferral can be across both the provincial property taxes, the business improvement area levies, and the residential property taxes and municipal non-residential property taxes is still being worked out. Obviously, that's where we get the majority of our revenue from. So in order to keep the lights on, if we're going to defer any significant portion of that $1.5 billion that gets collected, which is basically half of our budget, which we normally expect to come in May and June, then we need a considerable backstop from somebody, either the provincial or federal government, in order to be able to continue to pay firefighters, continue to pay police officers, continue to buy essential supplies and keep the lights on to operate local government. So I think we're going to get the support that we need to be able to offer sweeping relief. But I would say at this point, my sense is the greatest urgency is around the non-residential property taxes. And this does require some coordination with the province, because we collect a certain amount of the property tax on their behalf. And so if they can defer what they expect us to provide to them, we can pass that deferral on to ratepayers. And I think the broader those measures, the better. But really, it depends on the extent to which the provincial government can bridge municipalities while we offer those measures. So I would favor the broadest possible relief, but that's contingent on the backstop that we get from the province.
So how soon can we expect clarity on this?
I'm in contact with the Premier sort of constantly on this today, and our officials are working on this today. I would, but I can't announce something that is contingent on a provincial commitment. The sooner that provincial commitment comes, the sooner we can right size and tailor the relief to those who need it the most. And ideally, again, we would favor the broadest possible deferral, but that's contingent on the provincial backstop.
What have you learned from Calgary's state of local emergency, and the time since yesterday, I guess, as far as what powers they had under this provincial health insurance? What lessons can you learn?
So Calgary was a little bit ahead of the province, but we had the sense that the province was going there, and that particularly in our metropolitan context, a consistent approach, certainly across our region and across the province, is best. And the province has the most up-to-date information. So we chose, in anticipation the province would put in stronger measures through the public health emergency, we've chosen to follow lockstep with them. Calgary's made a different decision for various local reasons there. But at this point, we see, again, in our case and a lot of the work we've done on emergency preparedness, we think that you want to save state of local emergency because of the sweeping powers that it grants for when you really need it. And that time may well come in this situation, and we'll continue to review that. Calgary has a different philosophy around it. I won't comment on whose is better, but our council at this point wants to save those extraordinary measures for truly extraordinary circumstances. These are already that, but they're covered by the provincial orders that have been put in place.
We've heard it before, but can you just spell it out for us again? What, if you were to declare a state of local emergency, what more power does that give beyond this?
I'll let Adam speak to that, and then I think we've got a question on the phone, but I'll let Adam elaborate.
So the question was, what if we declared a state of local emergency, what additional powers would we have? They're actually very consistent with the powers of the provincial public health emergency that was declared. The number of indicators that we're using to assess that were presented to council today. There's 11 of them. Two that we're watching very closely is if this pandemic from a local perspective is getting sort of more broadly spread to a particular population, then we would likely come back to council with a recommendation of a state of local emergency because it is actually Edmonton specific. And the other one we're watching is the pricing or the potential adjusting of pricing in this time that and we're monitoring it regularly, that if we start to see something that is not supporting Edmontonians from a price perspective or constraining Edmontonians, then we would take that step. And if I could just add, the decisions that we've been making in not having a state of a local emergency in place are similar to the decisions that some municipalities made when they declared the state of local emergency. And in fact, we've enacted some of them earlier. So closure of the rec facilities, we did that without the state of local emergency. And again, the mayor said it. Can't really speak to the specifics of Calgary's decision, but they used the state of local emergency as a method to close those facilities. So we're monitoring on a regular basis to ensure that, as the mayor said, on a moment's notice, we're able to bring that advice to our emergency advisory committee, which is council, with a recommendation of state of local emergency if we need to, based on those 11 indicators.
Adam, we saw you get a little emotional at the start of the meeting today. Obviously, your concern is for city staff, for Edmontonians, but there's a lot on your shoulders too, a lot on your team. I guess, how are you and your team doing? What are you doing to get through this with all the emails and pressure on you? Because this is going to be a long haul as well.
So the question was, I'll forego the first part, but it was, what are we doing to prepare, and what are we doing as a leadership team just with the volume of activities that we have on our plate? And I'm going to start with the team. Fantastic team. We have a tremendous team of the executive leadership team, of the task team that we've assembled, and the folks that we have in our emergency operations center. And then I take it even further. The team of the City of Edmonton staff in the face of this have responded tremendously. And so the support network that we have and the decision-making systems that we have in place to respond is top-notch. And I think we do need to recognize every once in a while that we have to take a break. We need to just collect ourselves and compose ourselves and take the time to recharge. And the network that we have really helps us do that. But I can't say it stronger to say this is a fantastic team and a fantastic group of employees that are navigating through this situation. I would also like to thank our council, because Mayor Iveson and I have been in regular conversation. He's been very supportive, and all of council today I want to applaud them for their comments, their questions, and their support for our employees as we're working through this. Everybody's in this, and what I'm seeing is that everybody's pulling together in this. I would also like to, I said it yesterday, I'd like to thank the business community because when it came to those measures that came down from the provincial public health emergency declaration, we were already seeing our business community taking steps to protect their employees, to protect the public, and to contain this spread. So I said it before, in the Edmonton way, we're pulling together, we're compassionate, we're supportive, and we're considerate when it comes to this current situation.
So, since you're there, can you just expand upon the small business support? So, what is being planned, and what are you doing aside from the potential for property tax?
So the question is, can I expand on the support that we're providing to the business community? And we have a team that supports, it's called a one-on-one team that in regular times would support businesses and how do you get your business going, where's some advice on permits and the different approvals they need to get their business going. So we're actually shifting that team to be more focused on supporting the current businesses to enable them during this time, and is there anything that we can do to support? Is there any feedback you need to provide to us to be able to help you? The other thing we're doing with our business improvement areas, our BIAs, is we're setting up virtual meetings with them to be able to hear from them how we can help them at the City of Edmonton. The other thing we're doing with our business retention team is having them shift their focus again from day-to-day to current situation activities to support businesses. The mayor spoke very well in terms of the steps that could be, or the measures that could be coming down federally, provincially, from a financial perspective, and we're staying in touch with those conversations as well.
May I ask about
Oh.
I think it's for you, so.
Okay.
The 60 ETS operators that are self-imposing, self-isolating rather. Could you comment on that further? What are the symptoms, or put this into perspective a little bit, because I think I tweeted it and got a lot of traction on Twitter, and Arshon was asking about that as well.
Right, so we don't actually know where that 60 came from. The question was, can you provide a commentary on the 60 ETS employees that were referenced in a tweet related to self-isolation? And we don't know where that number came from specifically, but we do have employees that are taking the self-isolation steps, either following the direction that we provided to our employees, that if you're feeling sick, stay home, or they've gone through the Alberta Health Services guidelines in terms of self-isolation. We're taking steps to monitor that, but I wouldn't say that it's exclusive to ETS. I think it's across the city where employees are doing the right thing. They're taking the steps to contain and self-isolate. With respect to ETS, I can tell you that we've got just under 1,700 ETS operators. And I mentioned it today in council that the steps we took yesterday with transit were very strategic to ensure that we had employees and healthy employees to take us through this pandemic, which could be an extended length of time. So that's the context I would provide around that.
So 1,700, that's LRT and bus drivers? And is it more than that?
I can confirm that, but I believe that's our ETS operators, and there is some flexibility in terms of the ability to use those resources for bus or from LRT to bus. So I don't have the exact number, but we can certainly get that for you.
So yeah, I'm sorry, I'm confused then, because everyone heard 60 ETS employees are in self-isolation, and now we're doing something different. Is there a way to get?
I'm not, and I'm not sure where you heard that or where. That was a question from a councillor, and I think it was based off the information that's around in social media. We're trying to get a good understanding of across the city the number of employees that are in self-isolation. We don't have that at this point in time.
We heard the answer from, the number came from Deputy City Manager Gordon Sebrick. So could it be that some of them are staying home with children? Is that something that could be included in that number? You don't have any info on that?
Don't have info on that.
Would it be possible after this, just through the communications, to get some clarification on that one?
We can follow up.
Yeah, for sure.
And just in general, though, do you feel, are you getting reports from department managers that employees are saying, I think I should self-isolate, or do you think managers are saying, oh, please stay home, or is it a combination of both?
So the question is, do we feel like we're getting employees that are asking managers, should I self-isolate? And we've provided guidelines that get updated on a regular basis to our employees. They're actually on the website if you'd like to look at them, edmonton.ca/COVID-19. And it provides some guidelines for our managers, our directors, our supervisors to support our employees. But it starts at the basis, which is provided by Alberta Health Services, that if you're feeling sick, stay home, and then take the necessary steps if self-isolation is required with Alberta Health Services.
There still seem to be some concerns, at least on social media, in terms of the route service for transit. I know the city is looking at that and following that. If changes were to be implemented, how is that going to be communicated? If there are changes every day, could that get confusing for residents?
So the question is, there's regular monitoring of the transit system, and if we're going to make changes, how does that get communicated and how do you avoid confusion? That was kind of why we started with the Saturday service as the starting point, because that's commonly understood and easily found on our website. Our mechanism to provide those updates are through our website. It's happening real time, so it's certainly not going to be something that is immediate, but we're doing our best to ensure that folks are aware of the changes, and we'll continue to look at ways to improve that from a communication perspective. But I think what we want folks to do is go to the website to get that information, and we'll do our best to update as quickly as we can.
David mentioned it there, I don't know if you can paraphrase it, but so Laughlin was out last night, just making sure our businesses were closed. He said 3 to 4. Do you have any specific numbers on just how many were not compliant last night?
So the question is, do we know specific numbers on who weren't compliant? I don't have that. We can certainly provide that. I can talk to David when we're done here and share that with you. But I think the general theme is we're seeing solid cooperation from the businesses in actually even before the declaration of the provincial public health emergency. They were taking the steps which were guidelines provided by Alberta Health already, but we'll continue to monitor that, and we can get you that specific information following.
Back to transit, there was talk about changing fees, potentially looking at free transit. I know the low income pass is going to be used for April. Any concern that this might be encouraging more transit use in a time where a reduced service has just been implemented?
So the question is, we took the step with the low income monthly pass to extend that from March to April, and that we are looking at transit fees holistically, and will that in fact encourage transit? I think the numbers that we're seeing is that the transit numbers are going down significantly. We mentioned yesterday we had a 50%, almost 50% reduction from one Monday to the next. We're monitoring that, and I believe there's been a subsequent reduction. I apologize, I don't have the specific numbers. So I think, I don't believe so, but as I've said before, this is a very dynamic situation, and I can commit what we are doing is monitoring real time. We have our inspectors and our supervisors out in the field doing that real-time monitoring, and we're preparing, we're proactive, ensuring that we have our resources ready to go should we see either an increase or a decrease.
The mayor?
Sure.
Can I just?
Yes.
I'll just supplement on two things. The first is that the default expectation for the City of Edmonton as an employer is work from home, and depending on the unit and function of the city, obviously you can't drive a bus from home, so about 95% of our folks are at work in transit. Some of our other functions are 95% working from remote, but the default expectation is work from home, and that's to enable folks to support their families and to self-isolate as necessary. And if people need to self-isolate, they're being supported to do that, or on behalf of their children if necessary. So that's just to clarify on that, and we can get you specific numbers about transit and what the circumstances are there in the follow-up. The second is that we've had really good compliance. I understand when our bylaw officers have been out that if there was a variance or a deviation from the guidelines, that businesses were it was a misunderstanding of the guidelines, and businesses have been to the last really understanding and really proactive on their own or immediately responsive where enforcement has come to bear. But we can get you specific numbers about folks' boots on the street for that last night. And I think we had a fairly tame St. Patrick's Day as a result. I had an Irish Red last night at about 11:30, just one. So it was very, very low-key St. Patrick's Day. And then finally on transit, Adam and I were in consultation around this, and there's some logistical issues with pass pickup for the low-income pass. Those are done through rec centers, so I totally supported the measure to roll over the March passes. Calgary's done something similar. So there's a practical thing there. It does have a theoretical revenue implication, but that's not what's guiding decision making. The point is that was within his delegated authority, and a wholesale move around transit fares going forward has a much more serious budget implication and requires engagement with council to make that decision. That didn't, it came up a little bit today, but it's going to be part of the financial considerations for us when we get together on March 30th. So we'll have more to say, I'm sure, about pricing a number of things from our utilities to transit to taxes in the coming days, even as we get greater certainty about the fiscal backstop from the province to allow us to provide that relief. Again, the more robust that backstop from the province and or federal partners to support the city's liquidity, the more relief we'll be able to provide to user fee payers, rate payers, and taxpayers. So,
you mentioned yesterday you were calling for expedited coronavirus testing for frontline workers. Is there an update on that, and is that amplified by hearing the number that 60 ETS employees are self-isolating right now?
well, I'm not sure I'm still not sure about that number. There's some uncertainty, but notwithstanding that we have essential services workers from transit to police to fire who are out there on the front lines, and particularly for first responders responding to people who may be in distress and exhibiting symptoms, testing is necessary, and this is from my conversation with the police chief. So the Association of Police Chiefs is also following up on that. I don't have a response yet, but that's been our sort of, I guess, feedback. It's not a demand, it's a respectful request to Alberta Health Services to prioritize that testing. So I didn't frame it in the form of I want to hear back immediately, but we've certainly given that feedback on behalf of emergency management and essential service personnel, and again, the police chiefs have taken that position across the province as well, I understand.
You said you were optimistic about support from the province for the vulnerable population of homeless, but we haven't had any details about this yet. Is there anything else you can share with us today?
Well, yesterday there were some funds released, and the federal government has also, sorry, I'm really bad at repeating the question. The question was about, I've expressed confidence to, about provincial support for the homeless and vulnerable population, but we still don't have a lot of specifics yet. There was the $60 million of FCSS dollars yesterday. There were some additional federal dollars earmarked today for homeless serving agencies, and so the resources are starting to flow. What would be very helpful at this point would be clear empowerment from the provincial government to stand up the kind of facilities and response that is needed. I know the meetings are happening right now, so these things may be in progress, but we need to activate some facilities to host people who are either in distress or keep them separate from folks who may be who may have contracted the virus. And we need not just traditional sort of shelter and accommodation like you would see from the Fort McMurray fire, for example, but also a series of additional public health measures around that we need to coordinate with AHS, but also have support from community and social services. So there's some interagency, interministry work that needs to be resolved rapidly at the province. I have assurances that's going to happen, but when that happens, we should have greater clarity on the measures that will be put in place. But I see tremendous urgency around this. On my way home yesterday, I did a quick dashboard survey in our inner city, and the conditions that people have always experienced but are continuing to experience now on our streets are they're not able to observe social distancing. And so an outbreak in that community would be an avoidable public health tragedy. It's been avoidable for a long time, but no time like the present for us to end homelessness.
In terms of facilities there for those folks, maybe we'll get some decisions later today or later in the week, but what are the kinds of facilities you're looking at? Is it hotels that may not have visitors right now? Is it school gymnasiums? Is it university dormitories? What kinds of things?
Well, I don't want to speculate about which facilities might need to be activated over time, but there is a lot of spare capacity, both publicly and privately, in terms of either dormitories that aren't being used, hotels that are vacant, but also city facilities, conference centers and rec centers. So all of that's being evaluated for the optimal solution. I suspect in the fullness of time it will end up being a blend based on a desire to not mass congregate people. So I think at this point all options are on the table, and I think that I'd leave it to the experts to determine on the advice of public health officials what's the best answer there, but certainly I'm confident that the city stands ready to activate whatever facilities are needed to help accommodate people in the safest way for their health and for our staff who will be supporting them.
What about City Hall? Are we staying open for a while?
Sure. We're wondering that ourselves. Adam? You guys are always welcome.
So the question is, what about City Hall, and what are we doing with that? Are we keeping it open? And currently we are, but like everything else, continue to monitor and assess the situation and the influences or the indicators that could result in that closure. While I was off, I did confirm for folks on the 60. So there are 60 ETS employees, and what we don't have confirmation of is what type of employee and their location. So apologies if there was some confusion, and this reflects sort of the dynamic and ever-changing nature of this situation, that it is difficult to ensure that we've got the most up-to-date information for you, but what we know is it's 60 ETS employees, location and their job classification. We don't have that specific information.
So can you just say, are they self-isolating out of an abundance of caution, or?
And we don't know that as well. We don't know that either, sorry, Vinesh. Whether it's employee following our guidance that if you're sick, stay home, or if they've gone through the AHS guideline, we're not sure on that either.
But they're where they're supposed to be right now.
Yeah, very good point. But if not feeling well, they're where they're supposed to be right now, which is not coming to work and staying home.
Thanks, everybody.
Thank you very much.
Thank you,
Really
folks.
appreciate your time, and we will try and regularize these media availabilities and let you know in good time. Thanks for your patience, because we wrote it late today.
Thanks, folks.